Welcome back. Look, everybody, it's Beyonce. No, it's Dr. Heather Brown. Intelligent and beautiful.
Thank you.
Good morning, Dr. Brown.
Good morning.
You're here because it is Children's Dental Health Month.
That's correct.
Okay, I know you see a lot of kids in your practice, and what's some of the biggest mistakes that kids make that parents need to watch out for?
Proper brushing or improper brushing, basically, and not flossing their teeth. We want to make sure February is National Children's Dental Health Month, and what we want to do is just promote awareness of the importance of actually bringing your child in to see their dentist, at least by the age of 1.
That was going to be my next question. Okay, they barely have teeth at 1, but they need to start coming on in.
That's true. You need to actually take your child to see the dentist after at least 6 months after the first tooth erupts or by their first birthday.
Wow. Or what could happen?
Or they can end up with all types of problems in the future. They can end up with tooth decay, gum disease, a lot of other issues that can be prevented if you take your child in to see the dentist regularly.
And it'll cost you later. And one thing that we see with children a lot is the teeth start coming in all crooked, so then they need braces.
They need braces, and then that's where I come in.
Parents scream when they hear that. Oh, they need braces.
Yes.
But you especially, you are focused on a different kind of braces. But let's talk about all the options that parents have if their children need braces.
Well, first I'd like to say that the American Association of Orthodontists recommends that all children be seen by an orthodontist at least by the age of 7. And the reason why is because during that age or during the growing years, we can actually utilize different functional appliances to prevent them from having to have surgery or to prevent them from having to have teeth removed later on in life.
Okay, so at 7, go see an orthodontist, which is a person who specializes in straightening your teeth.
That's correct.
All right, let's talk first about this new gadget you have for straightening teeth. Explain this.
Okay, this is what we call the Excelodent Aura. It's actually a mouthpiece that creates what we call soft pulse technology. It actually stimulates the bone remodeling process down at the cellular level, which will actually increase tooth movement, and it also will cut your treatment time down of wearing braces or Invisalign. So it can actually cut your treatment time down by up to 50%.
So how does it work? You put it in your mouth and it like vibrates or something?
That's correct. You just hold it here. And if you hold it, you feel the vibration. So that's the micro pulse technology, the soft pulse technology.
Okay.
And it basically works at the cellular level.
Got it.
Where you have the breaking down of bone, the building up of bone.
Oh, and it's just plastic.
Yes.
You just hold it in your mouth. How long do you put it in your mouth?
20 minutes a day. And that's
20
all
minutes
it takes. Yep, 20 minutes a day.
All right, cuts down the braces time by 50%.
Yep.
Okay, now what do we have here?
Okay, so these are functional appliances that are actually used with kids during the growing ages. This is a rapid palatal expander, so it actually helps the child who has a jaw growth deficiency.
Wow.
It actually helps to expand the jaws to allow for all the teeth to erupt.
This goes under the tongue?
No, well, this is an upper one, so it's like this.
That makes a difference. I was going to say, that looks painful. Okay, all right. And
then this is also another appliance. This one is removable, so it allows you to properly turn it outside of the mouth, and it's easy to clean.
Gotcha. And then just quickly, let's talk about invisible braces or Invisaligns.
Okay, so here's the invisible right here.
Got it.
These are the Invisalign.
Hello. How are you today?
And they're really great because
teeth are white.
you get to change your aligners every 2 weeks, and a lot of people won't even really notice that you're straightening your teeth.
They're little plastic trays.
They're little plastic trays.
There's a series of them, and they straighten little by little by little. Very quickly, general price ranges, because parents need to know that.
Let's say prices can range anywhere from about $2,000 all the way up to $6,000, depending on what treatment option, the treatment time, if there are appliances that go along with it. But if you want to cut down your time and save a little bit of time, because time is money, right?
Yes, it is.
Then you can go with the Excelodent Aura.
Excelodent Aura cost?
It varies.
It varies. She has payment plans, as do all good orthodontists. Dr. Heather Brown, always a pleasure.
Thank you so much, Sherry.
It is 7:29. Don't go anywhere. Lots more coming up on KHOU 11 News Saturday morning.
The power